Torsion versus epididymitis. Let's talk about it. Nothing threatens the testicle of a young kid like the ability of the cord leading to it to twist and cut off blood flow. The first thing to know is torsion is usually a young man. I've not seen a 50-year-old torsion. I've seen a few in their early 20s. But a young man who has testicular pain, you got to be thinking about torsion. But the question is it torsion or is it epididymitis, which are the big two? So how do you sort that out? We're going to come back to ultrasound, but there are a few signs and symptoms. If the pain comes on very suddenly and it's associated with nausea and vomiting, you need to think torsion. Epididymitis usually will be a little bit more of a gradual onset than sudden like you get with testicular torsion. If you have a lot of urinary symptoms or an abnormal urinalysis consistent with infection, you're more likely to think epididymitis. Getting a great physical exam can be challenging because they're hurting, but in a torsion, you can sometimes feel a twist in the cord, while in a epididymitis, you might feel the testicle and right behind it, it's really tender. But ultrasound is now key. With bedside ultrasound being readily available, you look, if you see great flow, then you're more likely dealing with epididymitis or at least not torsion. Sometimes the flow seems less prominent in one testicle than the other, and this might be a case where you just decide to explore. It's also important to know torsion can be intermittent, meaning you can get a twist and it spontaneously untwists, but if the testicle is actively torsed and compromised, you're almost certainly going to see decreased flow on ultrasound.